Hi, I'm Jay Shubrook, and welcome to Connect with MOBEC. This video series is intended to be a resource for the community members in Solano County. Today's topic is diabetes and COVID-19, what you need to know. So what do we know about COVID-19? We know it's a coronavirus, like many viruses like the common cold and influenza. We know it's spread by respiratory droplets, which means that when we cough and sneeze, these droplets fly in the air and we can come in contact with them in our respiratory tract. Or that we can also get them from touching things where these droplets landed, and then we can then infect ourselves by touching our nose or mouth. We also know that COVID spreads faster than the flu. It affects more people that get exposed, and the symptoms can be quite a bit more variable than we first thought. Now, it is important to know that people, when they get COVID, can be infected and contagious before they even feel sick. And we know that certain people are much higher risk for COVID, including people with from ethnic minorities, older adults, and people with chronic disease. But I really also want to highlight that most people with COVID will have a full recovery. So while this is very serious, it is not a death sentence just by getting the infection. What do we not know? We actually don't know how long COVID's been in the United States. We don't know what the pattern will be for COVID. Is it going to be seasonal like the flu, or is it going to be continuous? And we don't really know why COVID seems to be different in the US than other places. We also don't know how long it's going to take before we have a prevention like a vaccine or significant treatment. We don't know how long it's going to last. And I know that's really scary and frustrating for a lot of us. So who's at highest risk for COVID? Certainly any of the older adults, anyone above the age of 65, anyone who lives in any kind of group home or long-term care facility, or anyone with a chronic disease, either of the lungs or metabolic disease like diabetes or high blood pressure. And we know that African Americans and Hispanic Americans seem to be getting more severe cases and getting COVID more often. Why are people at higher risk for COVID-19 when they have diabetes? Well, remember that diabetes is actually a collection of different disorders, not just a single disease. And generally when we talk about the risk, we're talking about people with type 2 diabetes. And we know that many people with type 2 are older. We know that there's a change in immunity when you have type 2 diabetes, and there's an increase in blocked blood vessels, which is an important component to complications related to COVID. Maybe there are certain enzymes that are related to diabetes medications. This still has to be determined, but we certainly know that if you have uncontrolled diabetes, you're at much higher risk. So what can you do to protect yourself? This is really important, and I'm so impressed how people have stayed home to reduce their risk of getting exposed. But if you do have to go out, please remember that you want to stay at least 6 feet from other people, because respiratory droplets typically can carry that in that distance. If someone coughs, sneezes, sings, or even speaks loudly. Please remember to wear a cloth over your face when you're around others. This doesn't have to be a fancy mask. It could be as simple as a bandana. This bandana is important for both protecting you from not touching your face and mouth and exposing yourself, as well as not shedding respiratory droplets to others. Remember that most people can be infected and contagious even before they know they have the disease. Please remember to wash your hands at least 20 seconds before and after you check your glucose or any time that you're touching other surfaces. And while we talk about using alcohol-based products that are at least 60% alcohol, soap and water, quite honestly, is the most effective way to wash your hands and prevent infection. And then remember to clean and disinfect other surfaces that you commonly touched by multiple people. What else can you do? If you have diabetes, please remember to take good care of yourself. This means keep your diabetes in control. This is not a time to skip medicines or change your medicines. This is a time to make sure that your diabetes, your blood pressure, your cholesterol, all is under good control, because that's the best thing you can do to prevent your risk outside of avoiding exposure. Try to reduce stress if you can, find ways to find joy and peacefulness, and remember that physical activity actually improves your immune system. So do the things that keep you well. Now, if you do get sick, develop a fever, a deep cough or shortness of breath, or one of those other symptoms like a loss of taste, please contact your healthcare provider. And remember that many providers, including us, are now providing telehealth. So it doesn't necessarily mean you have to go out into public. Please call us and let us know what you're feeling so we can help you do your best decision about what your next step is. And please do not stop taking your diabetes or blood pressure medicines unless you've been instructed by your healthcare provider. Now, who should get tested? Now, testing is not needed for everyone. Currently, the CDC is recommending testing for some high-risk populations. Those who are hospitalized, those people with symptoms, including healthcare facility workers, working in group community living settings, first responders, and people who are at high risk with symptoms. Now, that certainly is because there aren't enough tests, but as there become more tests, testing may become available for everyone. And we know that I'm currently recommending that people from high risk categories who, even if they don't have symptoms yet, might benefit from testing as well. And if you do know someone that gets COVID or you think you've been exposed, please contact your healthcare team right away. Make sure you keep up on your treatments and then see what testing you can get done. Well, is there testing available in Solano County? I'm happy to tell you there is now. There are 2 sites in Solano County open for anybody who wants to get tested. One of these is in Vacaville, the other is in Vallejo. The addresses are listed there. These are appointment only walk-through testing sites. So they're not drive-through. You can't just stop in. You do have to set an appointment between 7 a.m. and 7 p.m. Monday through Friday, but this is open to anyone who wants to get tested. How do you schedule your appointment? I've given you both the phone number and the website here so that you can make an appointment. And it's important that people know that the testing done here is by the nasal swab. The nasal swab is testing for live virus. This is probably the best test to let you know if you've been exposed to the coronavirus. It is up to 85% accurate, and it's going to allow you to know whether you need to isolate from those around you because you've been infected. The county has set up a system that you'll receive a card at the time of testing and allow you to get your results within 48 to 72 hours. And the website link is listed there below. Please keep an eye out for us. Connect with MOBEC and the MOBEC team. We'd be happy to see you visit our social media websites, including Facebook, Twitter, and Instagram. And because we're going to offer these sessions regularly, please provide questions back to us that you'd like us to ask, and we'll try to have live sessions where we address your questions. Thank you much for joining us on Connect with MOBEC video series. I have some resources available for you if you want more information. Thank you much. We'll see you soon.